Welcome to another version and another edition of A Conversation with Senator Michael Moore. My name is Kevin Byrne, and Senator Michael Moore is our state senator representing the second listed district, comprised of seven communities, one or the other, including Worcester right at the top of the list.
Well, underneath Shrewsbury.
Michael, it's been a while. Well, it isn't. It's been a month.
Yeah, about a month.
But the month was crazy month. It was Christmas and New Year's
So we now entered the new year.
and all that sort of stuff. And yesterday, I sat in front of my television for a period of time and watched the inauguration of the 47th President of the United States that happened yesterday, indoors.
Yes.
In Washington, D.C. So lots of things have changed. I mean, Christmas hasn't changed, but it's gone by, so it's changed that way, okay? And here we are again. What's going on under the Golden Dome?
Well,
You guys are still working. I mean, you're busy.
yeah, we actually, the Constitution requires that the legislature be sworn in on the first Wednesday,
First Wednesday.
which this year was January 1st. So New Year's Day, we were all in there being sworn in.
Oh, great. That's the way to do it.
Yeah, and then
And you raised your right hand for how many times?
eighth time.
8 times?
Yeah.
8 times. Wow.
Yeah.
Wow.
Yeah.
Good. Long
Yeah,
time.
long time.
Wow.
So
You're
so
going to become a senior senator of one of these days.
well, I guess sadly, I'm the senior senator for Worcester. For Worcester.
Robin Kennedy's younger than you are.
Yes, Robin
Oh, she
Kennedy
has a
and
third.
Ryan Fatman and Peter Durant.
Okay,
Yeah.
just a few. Huh?
Yeah, just a few.
Okay, good.
But
Okay.
so since then, we've been after we got sworn in, it became time for everyone to start filing the legislation for this upcoming session.
Gotcha.
So we,
And
fi-
when
we
does-
filed about 100 bills.
You did?
Yes, we filed
100.
100.
Okay, you're up there.
Yeah. So we filed those, and now we'll be looking at the co-sponsors. So the deadline, the filing deadline was 5 o'clock last Friday. So once the clerk's office gets those out, we can start reviewing all the bills that everyone else filed. Last session, so 2 years ago, there were 6,500 bills.
6,500.
So we'll see.
Wow.
So we'll see this year how many were filed. So
Well, you've got a lot of new folks.
I think the Senate we got 4. I'm not sure what the House.
The House seems to be talking about they've got more, and not the numbers of Republicans.
Yeah.
You know, they get all excited because they got 1 or 2, and they think that's the end of the world. You know, the beginning of the new, the beginning of a golden age.
Yes, that's very good.
That's a
I
new.
think I heard that term recently.
Yeah, somebody said that several times. Anyway, okay, so you're doing all that sort of stuff. There's stuff that Alex has sent to me,
So the things Alex sent to you were things that were completed during the month of December.
right?
So, so the
And
session.
it's getting it's in the 20s of
Yeah.
January.
Yeah, no. So this was.
It's
So
cold.
we didn't have time to
It's
talk
cold.
about this.
It's very
so-
cold out there today. Okay?
Yes, it is. Yep.
I know when I talk about the weather, this program isn't seen for a period of time after it's taped. And that's, everybody knows, well, yeah, we know that, Byrne, because we were there. But this is at least, when we talk about the weather, at least it's a historic document that will confirm what the weather was for all times, okay? Or as long as Shrewsbury Cable exists. All right, first thing I want to talk about is something that you were substantially involved with,
Yes.
a piece of legislation which has become legislation, correct?
Law.
I'm sorry, law.
Yes.
Right. You are the legislature who makes laws.
Yes. Proposes them, and then the governor has to sign off on
Proposes
it.
them, and somebody else does it. Okay. And this is fascinating because there are so many school buses
Yes.
all over the place. Shrewsbury, for example, if you hit the right time or the wrong time, you're going to see yellow buses on every street all over the place. And the issue, obviously, is apparently the substantial number of people who don't stop when a school bus stops to let
It
kids
was
off.
it,
Okay, or let kids on.
the violations, the amount of violations far exceeded what I thought they would.
Yeah, yeah. How do you were what you were a proponent of
Yes,
this, a real
yeah,
proponent.
yeah. So there were several bills that were filed. The legislation several of the legislators filed it. My legislation happened to be the one that my bill happened to be one that they merged the others into.
Okay.
So basically what happened was a former member of the Worcester School Committee called me up about, I don't know, 2 years ago, a year and a half ago, and said, "Hey, look, we're having all these issues with people who are violating the school bus law when the stop sign comes out in the bus.
Sure.
And I'd like to know if I would oppose this legislation." And
Who was that?
that was Tracy Novak.
Oh, sure, Tracy.
So filed it, and then House passed it, and the end of, I think, like August, around that time, in formal session, it came to us. And then we did it the middle to the end of December. The governor signed it. So basically what it does, it allows municipalities right now, it allows a municipality based on the vote of the school committee to authorize buses to be equipped with cameras.
Okay.
Now, the camera system cannot be, well, first I should say, again, so the camera system, the link, if you violate, the link will be sent, the picture will be sent directly to the police.
To the police.
To the police. The police will evaluate whether there actually is a violation or not.
Right.
If there's a violation, then they can then file charges.
And this is all done
Oh.
as we do the toll road now. It's all photographic.
Right, they're all photographic. If they determine there's not a violation, that film has to be deleted within 30 days.
Oh, okay.
If they determine there is a violation, the film has to be deleted 1 year from the resolution of the infraction, from the resolution of the infraction.
Okay.
So basically, the issue of a fine or the dismissal of it.
What's
Buses have to be posted that they have the cameras on them. So basically, part of the justification that helped us get this passed, September 1st of 2023 to October 10th of 2023, the city of Peabody was authorized to do a pilot program. And within a 5 to 6 week period, 864 violations were documented.
Wow.
There were no fines issued. So, but the violations were documented, and that data helped us get this bill passed.
Why did this require state legislation?
Oh, because one, it's not an officer.
It is allows cities and towns to install
Right.
these.
Because there was nothing that authorized them based on the photograph or the taking of a picture.
Oh, I see.
So it wasn't a police officer who was witnessing it.
Oh, I see. Oh, okay.
And also
So you needed a whole system to.
yes, and also too, is it, this allows for them to cite the vehicle.
Yes.
Doesn't necessarily mean that you were driving.
Right.
So if you're not driving it and you get the citation, then it falls upon the officer. That it falls upon the individual who's driving. Now, you either pay the fine or you have to identify who was driving the vehicle.
I got you.
So also separate from this, there was another piece of legislation similar to this that authorizes the MBTA and the regional transit authorities. So the WRTA in Worcester.
Yeah.
We think we just saw a few weeks ago, they had someone who was getting off the bus that got
Yeah,
struck and killed.
yeah, got killed.
So this authorizes them now to be able to put cameras on those buses. Don't know if they will or not, or if there was an interest, but so this has so far the reception we've gotten from most people are they're very happy with the passage of this school bus camera law.
Right. But again, it's up to
It's up to the city of town.
cities and towns
It's not a mandate.
to do it. It's expensive, I would assume.
Oh, it could be, and this is not meant to be a revenue enhancement procedure or
Wouldn't be, 'cause
proposal.
It's going to cost. A city or town. I mean, a town,
But the town, when the town's looking at the contract,
Yeah.
it's got to be based on the cost of the platform or the services. You can't. The language we have is prohibitive of looking at the revenues that are brought in to offset the cost.
I see. Okay. All right. Okay. But most of the buses now are owned by private private companies who contract with.
Maybe City of Worcester. So a larger community may own the road. The City of Worcester just 2 years ago purchased all their buses.
all their own
Yeah,
equipment.
they have all their buses now.
Oh, I didn't
Now
realize.
the other smaller communities,
Shrewsbury, for example, sends it out as a contract.
yeah, you're right. Most.
And what happens with that?
Oh, that would just they'd have to incorporate it as part of their bid.
Okay.
So if the community wants to do it, they incorporate it as part of the bid, and then whoever's bidding on the contract would then have to utilize the camera system.
I got you. Okay. Absolutely fascinating. Huh?
It is, yeah.
Very true. You know, it's just, I'm so conscious of that, especially, with the times of day, okay, 3 or 4 o'clock, the buses are all over the bloody place. And, I laugh. I said, going down Maple Avenue is like a trip to Africa, for Pete's sake. Every block you have to stop. And when the buses stop and the rest of it, and that sign goes out and the lights blink, those kids are off that bus in a flashing, and they're right across the street, 2 or 3 of them at a time. I'm saying, oh my God.
Well, that's the thing. If you look, if we're talking public safety of everyone's children.
Yeah.
Now, it's not like every child getting off the school bus is in high school. We have from middle school to first grade, or sometimes kindergarten, that when they get off the bus, they're excited.
Oh, of course.
So they're starting to go, whether it's the parent with the pet or just the
And
parent.
they are children
And they're kids, and they don't think about it.
that need to be protected. Okay. Well, congratulations with
Thank you.
getting that through. I hope Shrewsbury picks it up. Now, the second thing, healthcare.
Yes.
Private equity bill signed by the governor on January 10th. Governor Healy signed legislation to close loopholes in the healthcare market. Oh, I jumped ahead of myself. Okay, but let's take this one anyway. To expose the loopholes that have been exposed by the collapse of Stewart. Stewart Healthcare owned a private company.
Yeah.
As we all know from all of the coverage of this, I guess as a lawyer I still have to say alleged, okay, because I assume they deny everything, but they just raped and ravaged these companies, pulled dough out. Everybody made a ton of dough, and there were a substantial number of equity owners in Stewart,
Yep.
and also other people who are in it strictly for buck.
Yeah.
And the deal seemed to be, it's not a non-profit, it's a profit, and they were in it for profit, really and truly. Tell me about that.
So
You were enthused about this.
Oh no, I'm very happy it's got passed. We had Stewart actually owned one of the hospitals up in, I think it was Bolton.
Yes, it
and
was up in that
so
area. Closed
with the closing of that,
Yeah.
there is now no access to the medical services for the people of northern Worcester County, which means that they have to come down here
Right.
or go further into Middlesex, which now also impacts the patients here in this area because now there's more patients going to this one facility.
Absolutely.
So this, as you said,
And they also were having an issue with EMT. The EMT services in town, which I assume was the fire department, says we can't handle this. There's emergencies that have to be hospitalized immediately, and
you got a longer ride now.
we gotta
Yeah.
we gotta take them to.
So basically, it makes reforms to prevent acute care hospitals from selling land to real estate investment trusts, REITs. As you're saying, it expands the Attorney General's authority to monitor healthcare trends and enforce false claims acts by allowing the office to seek information regarding equity investors and real estate investment trusts and hold them liable for any false claims. It gives more authority under the state's Health Policy Commission to review and look at the operations of these facilities. Also, It enhances penalties for not complying with the Center for Health Analysis Information, CHEA. Expands DPH's authority over the Board of Registration to improve oversight and aligning board activities to a broader market and oversight goals.
The criticisms that I've heard, and obviously everybody has to blame somebody for this chaos that's happened by greed
Yep.
and fraud, is basically there wasn't enough review of what was going on. There wasn't enough vetting of
And the notification.
companies.
So this requires creditors, vendors, and the hospital to notify the state 60 days before any possible repossession of medical or surgical equipment.
Yeah, I saw that.
So,
Right.
yeah.
Okay. All right. Good idea.
Then there's the other one you jumped over regarding the pharmaceuticals.
Oh,
Pharma.
that's important.
Yeah.
I have to go back to Alex's pages. I've only got 10 today. Okay, so I'm doing real fine. One of this was, tell me, you tell me about it, rather than me trying to prep
Well,
you into
so
what
basically,
happens.
years ago, the state authorized the PBMs, which are the pharmacy benefit managers. So they're kind of like a middleman.
Wait, PBM.
Pharmacy benefit managers. So they're basically a middleman, and or the middle person who is supposed to deal with the hospital insurance providers and negotiate the better deal.
Right. Even with the drugstores.
Even with the drugstores, didn't really happen. Actually, there were some negotiations that they were cutting out some of the smaller pharmacies on what they could sell. So they were actually restricting access, and the costs, instead of going down on some of the prescription drugs, were going up. So basically, what this did, it provides oversight, increases the oversight of pharmacy benefit managers by CHEA. Again, that's the Center for Health Policy. So it increases that oversight, but it also, the bill requires health insurers to cover life-saving medications for diabetes, asthma, and certain heart conditions, with no limited out-of-pocket costs for patients. So, if you think, if you think about it,
that is very, very significant.
it is. If you think about it, you've got diabetes, you've got a heart condition, and you
Those are
can't.
outrageously expensive drugs.
And so you're gonna price something out of someone's costs to stay alive. It's gonna, again, like the other piece of legislation.
So what, I mean,
it's gonna,
what were the drugstores? CVS, okay, CVS or Walgreens, the two monster chains.
Right.
Okay. What was CVS doing? They would just, if somebody came in and they needed this
Well-
diabetes medication, which, can cost hundreds of dollars, what were they saying to these people? Your insurance won't cover this?
basically, yeah.
So it was basically the insurance company saying, no, we don't cover that anymore.
But you have the pharmacy benefit managers who were in the middle that were negotiating some of these contracts.
Okay.
And then you had some that they were restricting these smaller or independent pharmacies from being able to even access some of these pharmaceuticals to sell.
Okie dokie.
So, the contracts were allowing CVS, the Walmarts, the larger
Sure.
Walmarts to sell the larger, not just the retail chains to sell some of these.
I gotcha. Okay. All right.
And now, but basically what it does, it now, PBMs are also prohibited from making payments to pharmacy benefit consultants or brokers who work on behalf of the health plan.
Who do these people, who are PBM people? Who do they work
They're
with?
basically-
Who's their employer?
There could be a private company, an independent company that's hired to negotiate.
To do this sort of
do
stuff?
the work, yeah.
All right. Okay.
So,
All right. So they're not necessarily connected with either the CVS or the insurance company or
not even the pharmaceutical manufacturers.
the manufacturers. Okay. All right.
So pharmaceutical manufacturers and PBMs will now be included in the Health Policy Commission annual healthcare cost trends hearing. So this way it will be all factored into when we're looking at healthcare costs, a comprehensive look at it. It will be factored into all aspects of the Health Policy Commission's report on healthcare trends.
Okay, so the drugs that you mentioned, that the law basically says
Yeah.
there'll be no costs to the patient, to the person. How
Well,
does
they're capping the costs at it'll be $25 to $25 per 30 days.
I see? Okay, all right. So it's limiting
Yes,
the alleged copays.
correct.
Okay, which I guess can be expensive, unless you have Tufts, and pay a lot of money to Tufts to make sure.
You're paying one way or the other for your health care.
Premiums are $10. You know, I go in there, it's $10 or $20 or whatever. Okay. There's one I almost missed, and it was relating to mammograms.
Yes.
Tell me about that.
So this
This
is
is again part of this healthcare reform.
yes. So it came. So it's breast care screening. So in October we passed this. The bill requiring health insurance providers, including the GIC, the group insurance, and Mass Health, to provide coverage for diagnostic examinations for breast cancer, digital breast tomosynthesis screening.
I'm glad you said it. I tried, I couldn't do it.
So that's why you had me read this. Medically necessary and appropriate screening with breast magnetic resonance imaging. It allows also access to preventive screening. Mammograms is currently covered in the Affordable Care Act. This legislation will go further for covering certain screenings and exams not currently uniformly
So
covered.
is this brought about because it requires health insurance companies to including whatever the group insurance commission is and Mass
That they
Health,
weren't
we know
required to
what
cover
it is,
before,
to provide this coverage.
Yeah.
So were the insurance companies not covering
if
it?
they didn't want to. Yeah. So this now requires it. Yeah.
Okay, so there must have been an issue.
Oh yeah, yeah. For this issue to come up, yeah.
Okay.
So that this tried to address gaps in coverage. So according to the Department of Public Health, breast cancer was one of the leading causes of cancer among Massachusetts females between 2016 and 2020, accounting for over 30% of all new cancer diagnoses in the state, affecting more than 30,000 individuals. 4,000 Massachusetts
I
residents.
have 3 women in my life, my wife and 2 daughters, and they're all on a 6-month or a year basis. I think
Getting
Virginia
exams.
is up to a year or a year and a half, that it's scheduled.
Yeah.
You will go in, 1 year from your last mammogram. Okay.
One other thing that's come up, it was just in the media today, at the time, 6 minutes. Basically, under the Baker administration, right after the pandemic,
Yeah.
Massachusetts was identified as inappropriately spending $2 billion of pandemic relief money to cover unemployment
That's a
compensation.
big issue, just came up.
So, well, it's been known. It was identified right after the pandemic. The resolution.
This is dough that came in from the Fed.
Yes, yep, that was supposed to be used for pandemic relief. The unemployment in the Baker administration misspent the money. The pandemic relief money they misspent to pay for unemployment.
It wasn't supposed to be spent.
It wasn't supposed to be. So they sent over $2 billion. What was the amount that was identified was $2.5 billion was spent.
But isn't that part of wouldn't that have been a COVID related?
Not the money. There was federal money that was tied to COVID, but these funds were not tied to the cover certain COVID expenses. So they inappropriately spent $2.5 billion. So
That's been around for a while.
yeah. So the administration.
Where are you guys in the legislature going to find $2.9 billion?
That's a good question. So, everyone's been asking what's been going on with this because it's been lingering over our heads. So the administration finally just released their negotiation.
I saw a headline in the paper. I didn't get to read it.
Yeah, so they released a settlement, which is going to be a $2.5 billion settlement over 5 years. and
Oh,
with
so-
interest,
so
it's going to
You gotta pay it all back. Huh?
right. So with interest, it's going to be about $3 billion. So this was just released. So a lot of us, if it's at $4 or $5 billion a year, 400 to $500 billion a year. Yep.
Wow.
$1 million, not billion, $1 million a year.
Right.
So, yeah, so that's something that's, someone this morning who was talking and said, what are some of the goals? What are you going to be looking at to
So
tackle
the
certain issues?
settlement was,
Is it that we've got to be flexible?
was to pay it?
Yeah, yeah, well, yeah. I mean,
Okay.
so and the Haley administration signed the settlement agreement with the Biden administration before they left office.
Right.
So that's something now that's going to be impacting our budget. Again, I think we saw yesterday the new president released a bunch of executive orders, some tied to immigration. So we don't know the full. We'll have to see what the full effect of that's going to be on the migrants that we have here in Mass. I know he did away with certain immigration policies. So we'll see if that affects the TPS, or the asylum program.
Well, if I'm reading the papers correct today, those parts that I was able to get through, he's basically shut down the border.
Yeah.
Wow. And he's got to send troops down there.
Well, and
Because it's, quote, an invasion.
I think there's roughly about 200,000 immigrants or migrants here in
Who are
Massachusetts.
already scheduled for hearings.
Yeah, so we'll see how that. We have half of the migrants that we have right now. Excuse me, half of the people that we have in the emergency shelter system are Massachusetts residents. So the billion, or the administration just filed this up for additional money. So roughly the 1.5 billion, between 1 and 1.5 billion that is being spent. Half of those funds are covering Massachusetts residents. The other half are migrants who have come here and are here under the asylum process. So how that now is actually going to play out for the other half of for those migrants that are here, we'll have to see now how that plays out.
Right. It's a terrible issue. There were a whole bunch of letters in the editor to the Globe today, basically from people, obviously involved with homeless care and well-being, who are basically saying, the governor's done a terrible thing by apparently again trying to figure out how we can keep them all in shelters and not get them out of shelters.
Well, the government, the administration, I'm not saying they've done a wonderful job administering this, but they have at several times proposed putting caps on the shelter stay.
Yes.
And
Yeah,
so
she put a cap on the number that we're taking in, which is still, I think, 7,500. But
yeah. So there's been issue. I mean, one thing that I guess it's a little disturbing on the legislative end. We've been told over the last 2 years that we could not put any sort of residency requirements on access to the emergency shelters, that it was unconstitutional. But most recently, the governor, the administration has come out with some requirements that you could technically classify as a residency requirement. So it's going to be interesting now. I know myself and his other colleagues who, when these proposals come out, have been voicing some concern that we have been told that this was not constitutional. So we'll see. We'll see how it goes.
You're a Democrat, and I'm a Democrat. I've always been a very liberal Democrat. I'm not excited about what's going to happen in the next few months, but you know what? People elected legitimately. See, he makes me cough. A new president said, we will march ahead. And Michael, we have just actually finished this program
Hit the zeros?
exactly on time. Hey folks, join us again. Please view us. We'll be on very, very shortly. Have a good day.